Support comes from PCC Community Markets. PCC's in-store chefs are celebrating peak season citrus with an assortment of fresh deli recipes. Made from scratch daily, the dishes include creamy chipotle chicken salad and grilled lemon harissa green beans, with 15 PCC neighborhood locations.
Hey, it's Patricia Murphy. It's Tuesday. This is Seattle Now. It's been a year since Washington made headlines with the first COVID patient diagnosis in the U.S.
Honestly, I thought when we got this first patient, I thought, wow, this is incredible, and this is it.
Actually, this was just the beginning. Today, we'll open a time capsule and revisit that first case with the nurse who cared for him. But first, let's get you caught up. Under pressure to get more people vaccinated and faster than it's been going, Governor Inslee opened things up yesterday, effective immediately. If you're over 65, you can get a shot. But there's a catch. Inslee says the changes means there are about 1.5 million Washingtonians now eligible to get a shot, and the state is only getting about 100,000 doses a week.
You know, I have to be really forthright with Washingtonians. Patience is going to be one of the most important assets for us in the upcoming weeks and months.
The governor also announced 4 new mass vaccination sites set up to open throughout the state next week, along with some newly pledged help from Microsoft, Starbucks, and Costco. Security remains tight around the state capitol for going on more than a week now. The State Patrol said yesterday there haven't been any specific threats. Officials say the fences and National Guard troops will be there at least through the presidential inauguration tomorrow. But the conversation has started about when to wrap it up. And people are heading to the snow parks in record numbers this winter. Those state-maintained parking lots and trails are packed. Washington State Parks says it's sold 5 times more snow park permits this year than last year. If you're headed out for the first time, leave early and have a backup plan. The parks close once they're full. It has been a year since the first COVID patient in the U.S. was diagnosed in Everett. It happened the evening of January 20th, 2020. Nurse Robin Addison worked a 10-hour shift at Providence Medical Center that day. She was hoping for a relaxing evening.
Around about 8:30 or so, I thought, well, I'm just going to have a bath and take a glass of wine into the bath and read my book and enjoy my evening. So I had poured a glass of wine. I hadn't actually gotten around to drinking it, but I poured the glass of wine, and I was standing with one foot in the bathtub and my book, which happened to be on my phone. And the phone rings, and it's Sarah, our infection prevention manager. And she and I had worked together for a while now, but she never phoned me at home. So I thought, oh, this is interesting. So I answered the phone. And needless to say, I took that 1 foot right back out of the bathtub, put the wine that I hadn't gotten a chance to drink down, and went back to work.
The patient was a 30-year-old man who just returned from visiting family in Wuhan, China, and Robin was in charge of the specially trained team that cared for him. At the same time, at KUOW, we were getting ready to launch this podcast, and Robin agreed to talk with us for a pilot episode. She told us about the special room the patient stayed in, totally isolated from the rest of the hospital.
So he has a bed, he has a television. It has the regular machinery that you would see at the head of any hospital bed, oxygen, suction. We've tried to make him as comfortable as we can in there, so we got him a kettle in there so he can make himself some tea. He has his computer and his phone, and it kind of looks like any other hospital room, except that he's sort of stuck in there right now.
They put a lot of resources into treating this patient, and it begged the question, could we do this again if, say, 20 more people got sick?
Yes, we can. Yeah. Yes, this person has something that is a novel virus. It's something that we've not seen before up until the last couple of months. But we deal with isolation patients quite regularly. So, yes, we absolutely could deal with that.
Of course, a few more than 20 people got sick. Closer to 300,000 just here in Washington. And hospital capacity turned out to be one of the biggest concerns amid the pandemic. But this was before the pandemic started. One thing we had a totally different perspective on back then was masks.
A mask doesn't hurt. It's not going to do you any harm except possibly to your wallet. I would not wear one on the street. Unless you are spending time with somebody who has this virus, on the street, I don't think you're at risk. And I think that is what people are concerned about. What we really would recommend more strongly than that is, covering your cough, washing your hands, staying home if you're sick, all of the stuff that is really not nearly as interesting to talk about as a mask, but that really is more effective than wearing a mask on the street.
And of course, early on, people responded to this unknown virus with a lot of fear and confusion.
Well, you can't get it from going to a Chinese restaurant for dinner.
Wow. Okay.
Yeah. We had a phone call in our ER with that question.
This year has felt like a century. We're forever changed, and most of us could use a nice meal out. But for now, we'll still have to settle for takeout. I wanted to check back in with Robin now that we've all had time to reflect on those early days of the pandemic. So we called her up and listened back to our conversation together.
The whole conversation about the masks just made me snicker in a really sad sort of way. At the time, the best recommendations, because people were panic buying the masks, I think that was before the toilet paper, we needed masks for health professionals, and people were out on Amazon scooping out everything they could find. So the recommendation was not to wear a mask. And here we are 360-something days later. Everybody has a stack of them everywhere. I can't put a jacket on without finding at least two in a pocket.
Absolutely. What struck me about that conversation was how novel everything sounded at the time. He was a single patient.
Yeah.
How we had no idea that, as we're speaking, 4,100 people have died from this virus just yesterday.
Mm-hmm.
I'm curious at what point it clicked for you that this virus was going to be bigger than you thought.
So after the first patient left, we had a number of meetings. So he left at the end of January. I want to say around the 26th or 27th. I can't remember for certain. We had a number of meetings sort of planning around what we would do. And everybody just kind of took a deep breath and thought, well, that was interesting. And then we didn't hear anything for a couple of weeks. So at the end of February, Sarah, who is the infection prevention manager I work with the BEST team, she and I had been asked to go and shoot a video for correct donning and doffing of PPE for a coronavirus patient. So we were in a studio shooting this video, and Sarah's phone suddenly rang. And she kind of looked at it and she's like, oh gosh, keep going. I've got to go take this. So she did. And it turned out we'd had a couple more people had presented to the emergency department that afternoon. Then that weekend came. I want to say it was the last weekend of February, first weekend of March, thereabouts. And it just seemed like all hell broke loose that weekend. And then March happened, which I think March lasted about 6 years.
What were you thinking?
It was very hard to sort of think in terms of long-term stuff at that time. Mostly I was putting out fires. So one of the issues that we had as an organization was centered around PPE. And it wasn't that we didn't have enough. It was that the rules changed. It seemed like the rules changed at least once a day, if not more often. So, the poor staff, I would run around and say, okay, this is what we're doing today. And then a number of hours later, I'd have to go around and say, okay, belay that. We're going to do something different now. So that was a bit complicated for sure.
Other than the PPE and the general chaos, how has your work life changed over the past year?
We had to remake, and by we, I mean we as a healthcare profession worldwide, pretty much. We had to remake how healthcare is delivered in a lot of ways. So in the States, and specifically at the hospital I'm at, pre-COVID, the hospital was wide open to anybody. It was like going to a small town almost. You could walk in a multitude of doors. There was a cafeteria, there's a gift shop, there was a bistro, coffee shop place. I mean, some of the neighborhood people would come in and get their dinner every night at the cafeteria. So it was a very sort of busy, bustling kind of a place. And post-COVID, we had to shut down all of our entrances but one. We have to put a screening station at that entrance to make sure that people are wearing the appropriate PPE, if in fact they're allowed in. And if I want to go and get something to eat, I go and get it and bring it back to my office, or I sit alone in a cafeteria. You know, a year ago, I could go and sit with a group of 6, 8, 10 people and have a really good lunch. And now we eat alone. We work alone. In the emergency department, we still have a fair amount of teamwork going on. But because I'm in an office, I work alone for the day.
Now that you have the perspective, how are you thinking about this virus in terms of the future, of its trajectory?
I'm very excited for the vaccine. I really am. I think that's going to make a huge difference. But having said that, I like to think that it's going to become like the flu for us. And I hate to say that because it's a different virus, and a lot of people have said, oh, it's just like getting the flu, and this virus is not. But in terms of medical control of it, I would like to think that having the vaccine, I suspect that it's going to become sort of an annual event for us.
Well, Robin, I'd love to check back with you in a year, and hopefully we'll be having a wonderful conversation about how far we have come and how the COVID-19 and coronavirus is something that we're managing instead of trying to fight.
Oh, I would love to do that. I would dearly love to be able to say that.
Robin Addison is a nurse at Providence Medical Center in Everett. Really great to talk with you. Thank you.
Thank you.
Thanks for listening to Seattle Now. The show is produced by Clare McGrane, Caroline Chamberlain Gomez, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.